So there is a small topic of pre-implantation genetic testing for aneuploidy. All of you are tired? Want some break? 2 minutes? 5 minutes? Yes? Continue?
Yes, sir.
Okay, we'll continue. Okay, so now we have this one TOG article, pre-implantation genetic testing, and this is followed by one GTG on obesity. Okay, not very big. This is also very small. It will take hardly 5 minutes, but GTG we might go into the details. So pre-implantation genetic testing for aneuploidy. So PGT is divided into three: PGTM, that is for monogenic disorder; PGTSR for structural rearrangements which causes miscarriage; then PGTA for aneuploidy screening. So PGT, there are three types: M, SR, and A. PGTM, PGTSR, and PGTA, A for aneuploidy screening. Globally, PGTA and PGTSR are indicated for translocation carriers and women of advanced maternal age to improve the pregnancy rates and reduce the miscarriage rates. We have just seen in the recurrent miscarriages. Okay, so if at all we want to do PGT, we can go ahead with the PGT SR for translocation carriers, etc. And advanced maternal case, we may go ahead with the PGTA. Okay, what was the technique which was used in the past? They have used the fish technique, but nowadays they are not using fish. Fish has got certain disadvantages. Fish was used in the early stages of PGT. It's now less common for PGTA because it can only analyze limited number of chromosomes at a time and is not comprehensive as other methods. Okay, so what are the sources for this PGT? There are three potential sources for cellular material. One is a polar bodies from oocytes and zygotes. Okay, so this is a day one. First and second polar body is there. So that is one source, polar bodies from oocytes and zygote. Then second source is a blastomere from cleavage stage on day 3. So on day 3, you can take a cleavage stage biopsy. You can take blastomeres from the cleavage stage. Okay, that is a cleavage stage biopsy. Third is a trophoectodermal cells from blastocyst on day 5. Okay, you can take 5 to 10 trophoectodermal cells, okay, on day 5. So these are the three potential sources for the genetic material. Now let's see about something about the fish and cleavage stage biopsy and what are the disadvantages with that. What they say about fish, it allows only up to 12 chromosomes to be screened as defined by the chosen probes. It is dependent on the lab staff and the skill experience. Both actually, cleavage stage biopsy and fish, they will depend on the lab staff and experience. There will be signaling errors, screening errors in the fish signals because of the loss or damage of the nuclear material or diffuse signals, etc., etc. Hybridization failure, probe insufficiency. These are the problems with the fish. There is a significant risk of misdiagnosis when using a multi-probe panel on one cell. Okay, and low positive predictive value can result in exclusion of embryos for transfer that were actually euploid. So sometimes because it has got a low positive predictive value, even you may discard the euploid embryo. Okay, and it is poor at detection of the mosaicism. Okay, mosaicism is something like that the fetal cell line is different, the placental cell line is different, and this fish is unable to differentiate between the two. So this is poor at detecting the mosaicism. Now, what are the problems with cleavage stage biopsy? This potentially harms the embryo, which may lead to reduced implantation and pregnancy rates. It depends on the lab and staff skill and experience. Small amounts of DNA material to analyze, which may result in diagnostic failure, false positive and false negative. So with cleavage stage biopsy, you get a very small material. Okay. Now here also positive predictive value is low. Here you have got a diagnostic failure because of the small content and all. And in both cases, there is a problem of mosaicism. Mosaicism, potential misdiagnosis and inappropriate discarding or transfer of embryos, given that there are high rates of mosaicism in the cleavage stage biopsies. So cleavage stage biopsy has got a high rate of mosaicism, and fish is poor in detecting the mosaicism. So this mosaicism also creates a problem. Okay. Now coming to the current methods which are used in comprehensive chromosomal screening. So CCS, comprehensive chromosomal screening. So there are 4 techniques. Fish was the older technique. Now what the techniques which are recommended as per this talk are array comprehensive comparative genomic hybridization, that is ACGHS. This technique compares the embryo's DNA to control DNA to detect the changes in chromosome quality. So here embryo's DNA will be compared with the control DNA. Okay, that is ACGHS. The next is a real-time qPCR. or quantitative PCR, quantitative polymerase chain reaction. This is the quickest method. Okay, so among the newer one, quickest will be the qPCR. Then is a next generation sequencing. This is better actually, but it is the slowest. Okay, among all. NGS is more sensitive and cost-effective method that can analyze an entire chromosomal makeup of the embryo. So whole chromosomal genetic profiling you can do with the help of NGS, but it is the slowest method. Okay. Now next method is a single nucleotide polymorphism, SNP array. This method uses variations in the DNA sequences to detect the chromosomal abnormalities. So you just remember this qPCR is the quickest, NGS is slowest, but it will give you the complete genetic profiling. Okay. Now this, I'll skip this particular slide. There are no SBH here. Also nothing much to discuss, but if there is a comparison between the ACGH and quantitative PCR, NGS, and the SNP, that is single nucleotide polymorphism, we have seen that this is the fastest method, this qPCR, and this is the slowest one. Rest are moderate. Okay. Resolution is low. Highest resolution is with NGS. Okay. Accuracy is very high for NGS. Okay. It is high for targeted loci in qPCR, but it is very high for genome-wide screening. So, and what you get here is a whole genome amplification is required. Sample requirement is a whole genome amplification you have to do. And advantage here is a minimal DNA is needed. For qPCR, even if it is a minimal DNA, you can carry out. But what you get is a specific chromosomal regions only. And it is suitable, this NGS is suitable for aneuploidy, single gene disorders, small CNVs and SNPs also. Okay, so this is more wide useful. Now coming to the cost is very high for this NGS. Then typical use for comprehensive embryo profiling for NGS, and it is for quick check for specific abnormalities. If you know what you want to look for, then you can quickly do this qPCR. But here you can carry out whole embryo profiling. Even if you don't know what exactly you are looking for, you can get a complete profiling. Okay, well, rest are, this is better for screening for aneuploidy, and it detects subtle chromosomal abnormalities and inheritance patterns. So this is just a comparison between the all fours. So that finishes this small talk article also. Thank you.